chronic disease risk, unhealthy lifestyle characteristics are significantly higher in the LGBTQ plus community. And so much so, in fact, as far as this has emerged, that the American Heart Association recently published a scientific statement on this topic and drawing more attention to this topic. My name is Dr. Ross Arena. I'm a professor and department head at the University of Illinois Chicago. And I am pleased to be here with my daughter, Anna Maria, who will introduce herself.
Hi, I'm Anna Maria. I'm a junior at Jones College Prep.
And the title of our article is Risk of Chronic Systemic Inflammation and Disease Disparities in the LGBTQ Community. It's going to be published in Mayo Clinic Proceedings in the July issue. And so I think we should talk about maybe what brought us here first. My daughter is part of the LGBTQ community and had a science project. Do you want to talk a little bit about your science project?
Yes, so me and my friend were looking to submit a research project to a competition for MIT. And what we were looking at was cardiovascular issues, and we noticed that there was a lot less attention paid to women when it comes to cardiovascular issues.
Yeah, so we started to talk about that, and I'm a cardiovascular primary prevention, secondary prevention researcher through healthy lifestyle initiatives. Primarily, I've done a lot of work with cardiac rehabilitation, and we started to talk about this issue and did some searches in PubMed and found that there really wasn't a lot on this issue. So in our commentary, we wanted to specifically focus on systemic chronic inflammation in this community, and is that a potentially a piece of this issue? And in fact, we did find that in the LGBTQ plus community, asked through questionnaires primarily, and there's not a lot of literature, but the literature out there shows that there is a higher prevalence of depression and anxiety, and it is linked to chronic systemic inflammation. One of the questionnaires that has been used in the past in the research setting was by Wardecker et al. And used data from the midlife in the United States study to compare CRP and IL-6 levels according to sexual orientation. And sexual orientation was determined from a questionnaire. And then they further went on to try to determine if there were differences in inflammatory marker levels explained by perceptions of discrimination. And they used a questionnaire, a simple, straightforward questionnaire, asking one question: how often on a day-to-day basis do you experience discrimination? And then subjects rated the frequency that these things happened on a 1, which is never, to 4, often scale. So using this questionnaire and the results from it, individuals in the LGBTQ plus cohort who had higher scores and perceived daily discrimination more often had significantly higher levels of CRP and IL-6. So that's one example of how a questionnaire can be used. A straightforward questionnaire can open up a line of discussion about stress, anxiety, and discrimination, and if that impacts an individual's life, and then prompting the medical assessments that may be appropriate to best treat risk factors for that individual. All right, so thank you for watching this video, and we hope that viewers will go on to read our commentary in the July issue of Mayo Clinic Proceedings, and hopefully this is just the beginning of a more expansive line of inquiry in this area, because we certainly need more research that assesses if inflammation is in fact higher in this community, and then investigating treatment strategies to lower chronic systemic inflammation when it is identified to be high.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.